My name is Jenny Castillo, and I am the Regional Engagement Director for the Southern Economic Advancement Project, SEEP for short. SEEP works to broaden economic power and build a more equitable future, exploring policy designed to directly address the intersection of race, class, and gender with social and economic policy in the South. Focusing on 12 Southern states, Virginia, Georgia, Alabama, Florida, Tennessee, North Carolina, South Carolina, Arkansas, Mississippi, Louisiana, Kentucky, and West Virginia, and focusing on marginalized and vulnerable populations within the region, SEEP also amplifies the efforts of existing organizations and networks that work toward similar goals. We are extremely honored to be in partnership with Fair Count and NCOC and to bring you today's Pandemic to Prosperity South. Today's update will take a deep dive into new indicators that provide insight into how the South is faring in its COVID recovery. With analysis from subject matter experts at the National Conference on Citizenship, the discussion will compare indicators like employment, vaccine distribution, and state revenue changes. We will also be featuring interviews with Carlos Rivera, Chief Data Officer for the state of Virginia, and Robin Gomez, City Manager of Clarkston, Georgia, on priorities for recovery funds and data infrastructure needs for tracking the recovery. To kick us off, please help me welcome Denise and Allison from NCOC. Denise, Allison.
Thanks, Jenny.
I hear this storm in New Orleans, Allison.
It is raining hard here.
Yeah, hi, I'm Denise Ross. I'm a director with National Conference on Citizenship. Thank you so much, Jenny. We are excited to share the latest installment of our Pandemic to Prosperity South data series in collaboration with the team at Fair Count and Southern Economic Advancement Project. History has shown that crises accelerate pre-existing trends and disparities and permanently change societies and civic life. The next months and years will be defined by the recovery, and an equitable recovery requires data. Allison?
Next slide, please. Pandemic Prosperity is inspired by a report series we published here at the Data Center to track New Orleans post-Katrina recovery. We published the New Orleans Index on a regular basis, so everyone from grassroots to grass tops had access to a shared base of information that tracked conditions which changed rapidly over time. It also helped illuminate how the recovery was helping some demographic groups much more than others. The slideshow the slide here shows all the indicators in the edition of Pandemic to Prosperity that we released today, and we've highlighted the specific indicators we'll present in today's webinar. So do be sure to check out the whole report after this webinar. As you can see, we measure how COVID has affected lives and livelihoods, but also we track measures that are going to be important for recovery, such as high-functioning governments and civic institutions, and most importantly, metrics that assess how people are doing during the pandemic across geography, race, and gender.
Next slide, please. Though much of the country's attention right now is on the COVID surge in Michigan, most of the South is also at high risk of exposure to COVID. Those are areas highlighted in orange and red on this map. And 8 of 12 Southern states have higher than recommended rates of positive tests, meaning that they are not testing enough to know the true scale of COVID rates depicted on this map. 2 Southern counties, Chattahoochee, that thunder. Chattahoochee in Georgia and Caldwell County in Kentucky are currently in the top 10 for active case rates in the entire nation. Meanwhile, governors are removing business restrictions and many mask requirements, and many public health officials note that the surge in Michigan could be an early warning of how new variants can tear through an incompletely vaccinated population. Next slide, please. As concerning as nationwide case rates are, hospitalizations have revealed large disparities between racial groups. In this graph, we shaded the 3 pandemic waves in gray. You can see that when hospitalizations are at their worst during the pandemic waves, the gap between racial outcomes increases. Then the lines coalesce when overall rates are lower, such as what we're currently experiencing. American Indian, Black, and Hispanic individuals are now around 1.3 to 2.2 times more likely to have severe COVID impacts than white people. This is down from the disparity during the first wave when American Indians, that's the blue line, were being hospitalized at 6 to 10 times the rate of whites, the yellow line. As we often see, crises make disparities worse. New policies and resources should take into account these pre-existing disparities and pull them out by the root, or we'll keep seeing this pattern repeated, crisis after crisis. Next slide, please. This slide's about vaccinations. Virginia, West Virginia, and North Carolina, in dark and medium purple on this map, lead southern states in their share of residents who are vaccinated or plan to be. For the remaining states, especially Louisiana, Mississippi, Alabama, and Georgia, in very light purple, the challenge will be to decrease barriers. It will be crucial to design campaigns using evidence of what works. For example, research shows that celebrity or political endorsement, which seems like it might be a good idea, can actually backfire. And messages from trusted healthcare professionals are more effective. The Count Me in Georgia campaign takes this type of evidence-based approach, featuring current details on vaccine eligibility and locations, and video conversations with Black healthcare workers addressing common questions. In this deadly race between viral variants and vaccinations, there's no room for error. We'll need to double down on the data infrastructure for local governments to do timely tracking and make their data public so vaccination campaigns can make mid-course corrections as conditions rapidly change, as we know they will. Speaking of change, Allison covers job losses next.
Go to the next slide, please. And please, sorry about the thunder behind me. Real world conditions here. So this map shows loss of jobs since February 2020, just before the pandemic hit. The darker shades of blue are the greatest decreases in jobs. Across the South, 1.8 million jobs disappeared in the past year. Louisiana's economy was hit the hardest, with jobs down 8%. You probably heard recent headlines that were boasting that the U.S. gained nearly 1 million jobs in March, but remember, the nation is still down 8.4 million jobs compared to the month just before COVID hit. Next slide, please. This graphic shows employment rates by gender. That's the share of all adults with employment. The rest are either unemployed or not looking for work at all. The higher line is for men and the lower yellow line is women. Women's employment has been particularly hard hit during the pandemic. Since the beginning of the COVID recession, men have lost 3.8 million jobs, while women have lost 4.6 million jobs. Of these, roughly 1.4 million are mothers with school-age children, because the pandemic forced many mothers to take leave or drop out of the workforce entirely. Next slide, please. This graphic shows small business closures day by day since the beginning of the pandemic. Anything below the 0 line is a closure. The red line is the US and the other lines are our 12 southern states. States have differed in their shutdown policies to stop the virus's spread, but consumer buying behaviors has dramatically changed regardless of shutdown policies. The reduction in consumer spending, especially among higher income households, has taken a tremendous toll on small businesses. Most small businesses in leisure and hospitality are still closed as of late March, regardless of state COVID policies. Looking at all types of small businesses, about 1 in 3 were closed in Louisiana, Georgia, Florida, and Virginia as of late March. Also, many childcare centers have closed because these are small businesses that operate on really thin margins and just can't survive when their revenue suddenly drops. In Georgia, 55% of licensed childcare providers closed within 2 months of when COVID struck. The shuttering of childcare, of course, has a domino effect on parents' ability to work. The blue arrow that I stuck there points to a big dip down around February 19th. This was the moment when the deep freeze hit much of the South, even though Texas got all the media coverage. About half of small businesses in Arkansas, Kentucky, Louisiana, Mississippi, and Tennessee were closed that week. In fact, if you look at the drop in the red line, which is the U.S. average, you can see how this deep freeze in the South affected the U.S. economy as a whole. This highlights the disruptive potential of climate change on our economy. And if my electricity goes out, I think Denise will be able to pick up for me. So next slide. Apropos disaster damages. There's no doubt that climate disasters compounded the nation's misery over this last year. This map shows damages from climate and extreme weather disasters, with darker shades indicating the greatest damage per capita for that state. Last year, 6 hurricanes causing at least $1 billion in damage hit the South. When deploying pandemic recovery funding for housing and transportation and other infrastructure that's being proposed, it's really worth keeping climate resilience top of mind. How do you want to invest these funds so that our housing and our infrastructure won't need to be rebuilt again when the next round of extreme weather hits? Next slide, please. This map shows the percent of adults in each state that are late on rent or mortgage and fear that they'll be evicted or foreclosed upon in the next 2 months. Because the South has 1.8 million fewer jobs, especially in Kentucky and Louisiana in dark orange, there's a lot of uncertainty about housing. Unemployment insurance during the pandemic has been critical in keeping people in their homes, but not everyone who is eligible has even received their benefits, mostly because states didn't have the technology and administrative capacity to process such a huge increase in claims, which I'll talk more about in a little bit. But 2 recent stimulus bills contain a combined $52 billion in rental assistance. And this assistance is being doled out through hundreds of state and local emergency rental assistance programs that vary greatly, literally hundreds of them. This large number and variety of programs is likely to make getting financial assistance to renters complicated and cumbersome. States and localities will need to increase investments in staff and technology in order to get rental assistance to eligible individuals. Next slide. So now I'll turn it back to Dr. Jane Abrams-McLean for a conversation with Mr. Robin Gomez.
Ooh, Allison, that is a lot of thunder in the back, and so thank you very much to Allison and Denise for sharing that information. I think we're having a little bit of a technical difficulty getting Mr. Gomez on, and so we're going to switch to our next interview. And I'd like Jason, if you can bring Dee Dee and Mr. Gonzalez on, then we can go ahead and switch to that interview and take me out.
Okay, here we go. Hi, everyone. I want to thank you guys for joining us. I am the communications manager for SEEP, and forgive me as well. I also have some rain and thunder going on as I am in New Orleans, like Miss Allison. So with that, I want to introduce Mr. Carlos Rivera. He's the Chief Data Officer for the Commonwealth of Virginia. Oh, there we go. And one of our just a few data professionals in the relatively new state government role here in the South, along with Tennessee, North Carolina, and Florida. Prior to his appointment, Rivera served as Chief Data Officer for the Federal Transit Administration, a federal agency that supports local public transit. And I want to kind of start off my first drafted question with paying homage to my state here in Louisiana and yours in Virginia. You know, one of our points of success in rolling out the COVID-19 vaccine has been utilizing our resources and tools learned from hurricane preparedness. Now, how would you say your state's response to the opioid crisis has assisted in the rollout of vaccines there? And what data infrastructures were cross-shared between the two crises?
Thank you, Dee. That's a great question. So for a fact, the Framework for Addiction Analysis and Community Transformation, which is our opioid pilot project that we kicked off in Winchester, we were able to leverage not just the technology infrastructure, but also the governance and the legal framework that supports data sharing across multiple disparate agencies. So although we are one government, we do rely on different agencies to share data to support the operations of the vaccine administration. And so in order for us to do that, we need to have a governance framework that allows us to not just bring the right people to the table to have the conversations about what kinds of data assets we're going to contribute, but also having the Commonwealth Data Trust, that legal framework that allows us to be able to identify the roles and responsibilities of each of the data sharing participants. Because in many ways, these different organizations, these different agencies are not just contributing data or making data available through the data trust, but they're also using some of that data. And so there's a big difference between having a data trust and a data commons, where in a data commons, multiple organizations are just co-locating their data together and then everyone has access. In this case, that is not what's happening. What we have is a data trust where my office acts as a data broker or a catalyst to make sure that only those organizations that have the authority to access these data assets do get access to it. And so we take that responsibility very, very seriously. And so when an organization contributes their data into the trust, we are responsible and make sure that only those individuals and organizations that have been given prior approval are the ones that access those data assets. And given that, so the governance framework and the legal framework, then we leverage the technology infrastructure that we had for both FACT and some of the other projects that we have to be able to facilitate the transfer of those data assets, not just from those providing organizations, but also into the central environment where we do all of the entity matching, where we match individuals across multiple systems to be able to provide that holistic view to our stakeholders, our end users that are leveraging that intelligence to make frontline decisions.
Awesome, that's a great answer. And can you hit a little bit on the dashboard that you guys provide to the local health districts?
Fantastic. We first provided the dashboard for testing, right? So when we were out there doing COVID testing, we wanted to make sure that testing was done in an equitable manner and across all the different health districts and localities. So within Virginia, we have 35 health districts and 133 localities. And so of those localities, we wanted to make sure that each health district director had the right intelligence at their fingertips to be able to determine which localities are testing according to the parameters that they set, right? We're managing the performance of the testing environment. So that dashboard that we had available to them way back in May of last year was repurposed to provide them the intelligence they needed for the vaccine administration. So the same thing we were looking at in terms of how good are we doing with administering tests within these different localities, how good are we doing in administering the vaccine, not just within the localities, but also across different races, different ethnicities, different age groups, genders, looking across the board with regards to the phases, phase 1A, 1B, 1C, being able to look at all of those different parameters resulted in a dashboard with it started off as a dashboard, but it ended up being a visual query tool for this massive database of like 4.4 million individuals, almost half the population of Virginia is in this system right now, with 27 different parameters. Well, actually more than 27. So at the very beginning, you have 27 parameters that you can pick and choose and filter out all of the different individuals that you then want to invite to the clinics. So we're really giving them a ton of intelligence at the hands of over 200 different individuals across 35 different health districts to be able to manage the vaccine administration process, which in and of itself is a huge endeavor.
Wow, that's really, really impressive. And with those dashboards, it seems like they're really useful, like you were saying, with towns who don't have their own process to actually their own staff to process the data. What else are you guys doing to support those local data capacities?
Yeah, absolutely. So the dashboard is one aspect of it. The other aspect of it is giving a lot of those localities that already have some kind of technical proficiency direct API access in to the backend data. So the data assets, let me step back a second, because we do a lot of cleaning, curating, standardizing. Like we're bringing in data from now 5 different systems, integrating it every night, doing the matching events. So there's a lot of stuff that, a lot of value added stuff that's happening behind the scenes that each of these different localities don't have to do anymore, right? So when they get access to this data, whether it's through the dashboard or the API environment, they're getting a curated, clean, standardized, ready to go data asset that they can then leverage for whatever other processes they need. So essentially what we're trying to do is centralize as much of the heavy lifting as we possibly can. So when it gets into the hands of the localities, they're able to run with it and be able to use this intelligence directly in their day-to-day operations.
Oh, wow. And with that, I wanted you to hit on for the audience as well, a little bit about the IT apprenticeship program, if you can.
Sure. So the Rural IT Apprenticeship Program is a program that we originally created last year during the previous legislative session, which essentially, and this was a pet project of mine to help with data documentation. So one of the things that we all are very, very frustrated with is the lack of documentation a lot of our data assets have. And so what I wanted to do is engage our rural communities in being able to start incorporating more data acumen training into these communities by not just providing courses, but providing work, right? Because the data documentation process is a tedious process, and it's something that we all think it's great for somebody else to do, right? And so being able to leverage that need that the Commonwealth has, I mean, we have thousands and thousands of data sets that need to be documented. And so no one's going to do that, right? No one within the Commonwealth, within their operational constructs are going to set aside time to document those data assets. So we needed to have a way to bring on the talent to do it, but at the same time, be a benefit to those communities that are then able to take those individuals that now have this expanded acumen, be able to say, okay, well, now they're marketable. They can have much better paying jobs. They can participate in the digital economy, which is something that, for many, many communities is a big chasm, right? Not being able to participate in the digital economy is one of those things where, it defines whether or not you're able to make a really good living and be able to be resilient when events like this, when a pandemic hits, that you're forced to work remotely. If you don't have a digital job, how can you work remotely, right? And so being able to, spread the butter, if you will, spread the peanut butter, if you will, across the Commonwealth, so that engaging different rural communities. So as we're thinking about broadband expansion, we're also thinking about data acumen training and making people more aware of the value of data and being digitally competent in the larger economy.
Awesome. And going into, you talked about the pandemic a little bit, going into the relief for the pandemic with the $350 billion coming to state and local governments as a part of Biden's American Rescue Plan. Why should state and local governments carve out resources for data infrastructure and transparency, especially to help ensure that equity is at the front and center of this recovery that we are trying to achieve?
Well, I mean, it's that old adage, right? What isn't measured isn't managed. Right. And so if you really want to be able to determine whether or not you are doing things in an equitable fashion and you're having the results that you want, data has to be front and center. If you're not managing the data streams that are documenting how these operations occur, then you're not really having your finger on the pulse, right? You're still leading by gut. And that's not the way we need to be doing things, right? We've changed our focus, and we've really looked at a more data-driven, informed, evidence-based approach to making these types of decisions that really impact the lives of many, many thousands, if not millions, of our residents at any given time. So again, data has to be at the center, because that's the only way that you can objectively look at the problem and be able to identify what are some of the solutions that you need to implement and whether those solutions actually work.
Carlos, we really appreciate your time and taking the time out to help us kind of get this information to people, and hopefully they can take some of your best practices and learn from what you guys have already pushed to start. So with that, I'm going to turn it back over to NCOC with Allison and Denise. Thank you again, Mr. Carlos.
Thank you, Didi. It's been a pleasure.
Thank you, Carlos. That was so great. I'm reminded of after Katrina, how there were all these pre-existing disparities that were exacerbated by the storm. But then on top of it, we had disparities in data access for the different neighborhoods. And so I appreciate your intentionality in making sure that not only do communities have broadband access, but also the digital literacy skills to participate in a modern workforce. So I'm going to start, I think, on slide 12, Jason. Talking about excess deaths. Soon after the pandemic began, emergency room staff across America noticed that their normal flow of non-COVID patients had slowed to a trickle, and appointments for cancer follow-ups, childhood immunizations, and chronic ailments like asthma and diabetes plummeted. I suspect most of us have got a whole list of appointments that we've put off. So it's not surprising in this context that for every 5 known COVID deaths in light blue here, 2 more people have died beyond the number expected nationwide since the pandemic began. Such excess deaths, which are represented in dark blue on this graph, reflect a variety of challenges. Some could have been misclassified and were actually COVID cases. Some deaths may have been patients reluctant to seek care in a pandemic, and others may have fallen through cracks in the healthcare system. The weak public health infrastructure at the root of these excess deaths in America also applies to data reporting. This chart only goes back through January 2nd because the backlog in states reporting deaths makes more recent data potentially misleading. So we've been here before with death data. With the opioid epidemic, many coroner offices are chronically understaffed and lack effective data systems. Insufficient standards for coding the cause of death, along with poor quality and lagging data on opioid deaths, allowed that crisis to sneak up on us as a nation. So this is an example, like Carlos was just talking about, where investing in data infrastructure now will put us in a better position to respond to the next public health crisis. Next slide.
Investing in the future, of course, requires having enough budget. This graph shows each state's change in tax revenue in 2020 from the previous year, which varied greatly across states. The largest reduction in the South came from Florida with an 11% loss, mostly due to depressed tourism. Louisiana was right there with 7.5% loss due to loss of tourism and oil and gas revenues also. And then, of course, disasters that really hammered the state's economy. West Virginia was down 4% because of decreased demand for natural gas and coal. States like Alabama and North Carolina saw increases in 2020. Both states rely heavily on property taxes, which has been more resilient during the pandemic. So that's always a good lesson learned. The American Rescue Plan provides $350 billion, as we mentioned, in support for states, cities, and counties. Localities will have big decisions to make about whether to use these funds to just plug budget shortfalls or to invest in the future, right? In supports like workforce development initiatives that prepare workers for an exponentially more digital economy, as Carlos mentioned, and in resilient childcare businesses and schools that can continue to function regardless of shocks that are going to come our way. Localities will also, as we've mentioned, have to build the data infrastructure needed to track the delivery of public assistance benefits to a historic number of claimants and to measure the effectiveness of brand new programs that we need for digital education and skill building, for example. Most immediately, of course, states and localities need robust data systems to track vaccine distribution, as we've talked about, including, reliable statistics by race to ensure equitable distribution. Next slide, please. This map shows percent of households without a computer or internet access. Southern states have less internet access as a whole than the nation. More than 1 in 10 people lack internet access in each southern state. In rural areas of America, there are fewer broadband providers and slower internet speeds. Counties in the Mississippi River Basin have among the lowest rates of broadband subscriptions. The COVID pandemic made clear that internet has become an essential utility for every American. Having access to a computer and broadband is essential for education and for homework, for job seeking and skill building. It's essential for small business development and success. Internet access is even essential in the farming industry today, believe it or not. So expanded investments in broadband could lay the foundation for America's economy for this century, just like investments in the U.S. interstate highway system laid the foundation for the American economy from 1960 forward. Next slide, please. You're on mute, Denise.
Thank you. One of the most basic metrics for how students are faring in this pandemic is whether they are attending classes. There's a lot going on with this data, so I want to pull back the layers a little bit. In this graph, we focus on the non-attendance rate. Generally, that represents the percent of students who are enrolled but don't show up on a typical day. These are the remote-only 8th graders, and there's been a lot of variation in how states and school districts track attendance for online students. So even with all those caveats, these data are concerning. The black dotted line represents non-attendance of all 8th graders in remote learning. The blue bars represent data for the most vulnerable students. Dark blue is those who are economically disadvantaged, medium blue is for English learners, and light blue is for children with disabilities. Next slide, please. Students in these vulnerable groups in Alabama, Arkansas, Kentucky, and Louisiana all have non-attendance rates at least 5 percentage points higher than the total population of 8th graders in their states. Some are substantially higher. Check out Arkansas's non-attendance rates for students with disabilities. It's 5 times the total. Next slide. Disparities in attendance in Virginia and Florida appear to be low, but likely for different reasons. Virginia has standardized mandatory attendance reporting, and the state schools prioritize 60% of English learners and 79% of students with disabilities for in-person learning. Those are the highest prioritization rates in the nation. So kids who needed in-person learning the most were likely to get it in Virginia. Florida, in contrast, is the only state in the South with no statewide attendance policies or data reporting standards. So it's hard to have a lot of confidence in those numbers. Next slide, please. Finally, let's take a look at the data that are missing. Normally, there's a time lag of more than a year before data on attendance are all reported up and published. We know that there are trade-offs between data quality and how timely data are. And that's why we were thrilled when the Department of Education's Institute of Education Sciences started publishing monthly updates from a pilot survey of schools. These data are still a little bit sketchy due to uneven response rates and data reporting standards across states, but they point to a much larger crisis ahead for our nation's children. 7 southern states with the red arrows here did not meet reporting standards or declined to share data for one or more of the vulnerable student populations. Additionally, attendance data like this misses all the students who are not enrolled in school at all during the pandemic. Next slide.
From roughly August through December last year, most unemployed workers received only the benefits offered by each state, with no additional $300 per week. This map shows the counties where those who receive only state unemployment benefits can actually afford the basic cost of living, of rent and food and transportation. That turns out to be nowhere in the South except Kentucky. With 1.8 million fewer jobs, as I've said, state labor departments have faced a historic deluge of unemployment claims. Many applicants have struggled to navigate unemployment systems, with some facing unanswered calls and long pending claims. A SEEP survey of SNAP households found that 1 in 5 had difficulty navigating through the unemployment benefits process. In addition, some states have struggled to verify applicants' identity due to antiquated verification systems, which contributed to a substantial number of fraudulent claims. States have slashed labor departments' budgets in recent years, leaving them with insufficient staff and outdated technology, unable to handle the COVID surge in claims. States will need to make substantial investments in administrative capacity and technology to ensure that eligible applicants receive the benefits to which they are entitled in a timely manner. And these also will be important for reducing fraud. Next slide, please. So here's our website, pandemictoprosperity.org, so you can access the full report and our contact info if you'd like to reach out. We're incredibly lucky that this data is available. As you can see, data does not grow on trees. It requires people to create definitions and protocols and technology to hold and transmit it. But data will become more and more important as large sums of federal funds come to states and localities. Next slide, please. Now I'll turn it back, or actually, I guess I'll turn it over to Dr. Janine Abrams-McLean for her interview with Mr. Carlos Rivera. Oh, no, I'm sorry. She's interviewing Mr. Robin Gomez.
Hi, everyone. I hope that you can hear me. Just making sure. We've had a few technical difficulties. We're going to try and get Mr. Gomez on later on and splice him into this interview. So right now, we are going to go ahead and kick it back over to Jenny, who is going to help get us started on our Q&A.
Thanks so much, Janine. We are so happy that we were able to hear such valuable information from NCOC and from Mr. Rivera and Dee Dee. We are going to bring in our speakers back on stage so we can talk a little bit about some of the questions that folks have. But also, I want to encourage our listeners who are out there on Facebook, on YouTube. If you have any other questions as we're going through this portion, please feel free to drop them in the chat and we'll get to them. Our first question is, our state doesn't have a CDO. How do we make the case for someone like Carlos? Mr. Rivera, would you like to speak on that?
Sure. So we have an awesome resource, Tyler Claycamp, who is with the State CDO Network out of Georgetown University. He used to be the former Connecticut CDO, is the director of the State CDO Network. And so they've been putting together a ton of materials that states could use to not just document why they need a CDO, but what are the steps they need to take to create a CDO position within state government. So I would definitely suggest you reach out to Tyler Claycamp at the State CDO Network.
Awesome. We'll make sure to share his contact information to folks on our listserv after this. Thank you so much, Mr. Rivera. My next question, how much should a state carve out for data infrastructure? Anybody who would like to answer that?
I can start with that. So going back to the to 2009 with the American Recovery and Reinvestment Act, OMB at that time issued guidance to states authorizing them to use 0.5% of their ARA funds from certain programs to support administrative and reporting requirements. So 0.5% might be a good place to start. And you know, as we've seen, especially Carlos's work in Virginia, investments made in tech and data infrastructure pay off for whatever the next crisis might be. Carlos, do you have any additional thoughts on how a state might carve out resources?
Denise, I definitely don't have a good metric to use because all states are different and all organizations are different. And so really looking at the data landscape, right? What are the different systems that you guys have and how are they connected, or how do you want them to be connected? And obviously, like in Virginia, we have thousands of different data systems and we're not going to integrate them all. There's just no way, right? So at least not in the short term. But you do have to identify which are those systems that are going to provide the most value for the amount of work that you're putting in, and then be able to identify what are some of the common needs across all the different entities, so that you can start building out some centralized services that really help. And so those centralized services, I haven't done the math of 0.5% would look like for my office. I'm pretty sure it'll be a lot more than what we currently get every year. But it's really looking at what is it that the organization needs, and then being able to identify how you can provide a central service that minimizes the redundancy in the operations, right? How many people are doing the same things over and over that really just doesn't add to the efficiency and really makes the state pay a lot more than really what it should for the same types of services.
Thank you. Anybody else want to add to that? Okay, another question here. If I want to be part of influencing my city or county spend the federal funding, how could I plug in? Anybody who would like to answer?
Well, I can get started on that. Part of the reason that we launched Pandemic to Prosperity South was not just to make sure that people could get access to the data, was so that they could use those data to actually influence their communities. And so now all of you who are watching, you now know that we're about to get an influx of money into local communities through the new act. I don't want to mess up the name because I'm pretty. So we're about to get an influx of money into communities. And so as community members, we have a say. We can have a say in where that money goes. Unfortunately, we didn't get to have Mr. Gomez come on, but in his city of Clarkston, he actually worked with the community to make sure that funding from the previous stimulus funding came in and went to different aspects of the community that really mattered. Housing, affordable housing, infrastructure, internet access, all of these things that really mattered to the community, while you had a similar town in Georgia where they put all of their money into the police force. And so in Clarkston, where Mr. Gomez is from, you had city leaders actually paying attention to the needs of the people in their cities. And the only way that people will know what your needs are is if you talk to them. So talk to the staff, talk to the local leaders, talk to your legislators, but make sure that your needs, your personal needs, the needs for your neighborhood, your community are heard. And that's the best way that you can get engaged.
Thank you so much, Janine. Anybody else would like to add? How can folks get involved in this process? As you know, we as organizations are always looking to plug folks in. So make sure you're visiting our websites and our Instagrams and our Twitters and our Facebook pages so that you can stay updated with as much information as possible, because anything that we can provide as organizations, we want to make sure we're giving you all the most updated information available. To our folks at NCOC, was there anything that really surprised you in the data?
I get asked that question a lot, and I always struggle with answering it because, and being a disaster veteran, you learn to not be surprised. But I think that what surprised a lot of other people was, and what in many ways does continue to surprise me, is that our recovery policies are so mismatched with who we are as a country, right? They're designed assuming everybody is a married couple with one spouse not working, right? So we can just close all the schools and it'll be fine. And that is so not our reality. Similarly, a lot of the application processes, even just to get a vaccine, assume you have the internet, right? And, many folks do not have the internet, and even some folks who maybe do, can use it to FaceTime with their grandchildren, but that doesn't mean they can navigate all kinds of application processes, right? So the policies really don't understand how diverse we are as a country, and I don't mean just in terms of race, but in terms of, household structure, in terms of internet access, in terms of income, Another one is, if you have COVID, go home and self-isolate. Well, we knew in New Orleans that, so many people lived in housing where they only had one bathroom. And now the census came out today with 38% of all U.S. households did not have the kind of, a separate bathroom and bedroom necessary to isolate a family member if they were sick. So sending people home just spread COVID through households. So I think I'm always surprised that decision makers aren't aware of the realities of how people live, the demographic realities, and making policies that make sense for those realities.
Thank you for that. Denise, would you like to add on that?
Yeah, I will say, as we were writing this, I was struck by how every time we write the Pandemic to Prosperity report every quarter, and conditions change so rapidly. And now, we're sort of pivoting toward, even looking towards schools potentially reopening in the fall. The focus, is less on access to testing now and more on access to vaccines. And it just requires, we had to change a lot of the verbs even that we were using because we're in this inflection point right now. And it reminds me that by the time you build a solution in a rapidly changing recovery context like this, it may be obsolete by the time you're done. And so it's so important to have your ducks in a row for what's coming next, and sort of keep looking, a few steps ahead so that you're ready for the next phase of the recovery.
Thank you for that. We had a question here from YouTube. I'm concerned about our elderly who live alone, as well as disabled, or those who are not internet savvy, who aren't getting vaccinated. Any news, good or bad, on these groups? Anybody who would like to answer?
So I'm happy to talk about what we're doing in Virginia. So there's a couple of things. One, we have a call center, right? So even if you're not technically savvy, don't have internet access, you can call the call center and they can help you get registered and document what your accommodations or needs are. In addition to that, because we've created the pre-registration system that facilitates the identifying of what the demand signals are for vaccines across the Commonwealth, across race, ethnicity, gender, all kinds of different categories and demographics, we're able to leverage that information to get community-based and faith-based groups out into those communities and canvassing them and helping individuals register, raising awareness. So it's not just about throwing billboards up or sending out, Twitter feeds and all that stuff. It's because a lot of the population just isn't aware. And when you look at the demographics, so it's funny because one of the things that created this whole awareness is the demographics of the people getting vaccinated, right? And obviously the larger percentage of the people getting vaccinated were white. And then when you look at the people pre-registering, well, that's not surprising. The large number of people pre-registering are white. Why? Because they're the only ones that are paying attention and know where to look for this kind of information. So we need to do a better job of getting out into the communities where they are and being able to provide that messaging. And that's what the whole strategy is about, is creating the infrastructure that facilitates everyone's engagement with the process, not just those individuals that, as Dr. Plyer had mentioned, have the resources, have the ability, have the understanding to know where to look and what to do, and being able to make this as an even playing field as we possibly can.
And I'll just echo everything that you just said, Mr. Rivero. So SEEP and Fair Count, actually in March, we partnered on, and Dr. Plyer and Denise mentioned this earlier, on our Count Me In. So it's called the Road to Recovery Count Me In campaign. And as a part of this campaign, what we are doing is exactly what you were talking about. We have our organizers who are on the ground that are, doing door hangers, that are making thousands of phone calls, sending hundreds of thousands of text messages. We actually just did last week a teletown hall for a rural county in Georgia, Clay County and surrounding counties, to answer questions about vaccinations, and to also send them towards to a local a clinic that was doing vaccines. And on our website, we give people information, because the inequity that we're seeing is not just inequity around vaccine access. It's also inequity with regard to information about vaccines. So a lot of people are not getting they're getting, messages from their uncle that says, you can get that they're going to inject microchips or other misinformation like that. And so what we're really trying to do is dispel that misinformation and give people correct information so that they can make informed decisions about their health and the health of their families. Now, when it comes to elderly folks that and those that aren't tech savvy, we are sending them. We have our website, but our phone calls and our text messages and our door hangers also send people to a phone number so that they can call their local Department of Public Health to get signed up for a vaccine. We're also looking into ways that we can, contact maybe through mobile units, homebound seniors and other homebound individuals, and identify them and bring the vaccines to them. We have had some successful cases of this or examples of this in Georgia, and I've heard of cases elsewhere. And so we're really looking into how we can make sure that those folks that can't, even if they can get signed up, that don't have the ability to get out to one of the mass vaccination sites or to their doctors. And so we are looking into that.
Hey, can I add something real quick, Jenny? Because you did mention something extremely important is getting the information out. And one of the things that we're doing is publishing a health equity dashboard in the next week or so that talks about all of these different capabilities and what are the disparities and how we're addressing them, so that we're giving the lens back to the residents to see how well your government is doing in being able to provide these services. And again, that homebound population, we were just having that conversation about that this morning, and there are localities that have engaged their local EMS to be able to provide those services to those individuals that can't leave their homes for whatever reason. So there's I mean, like you were mentioning, Dr. Player, it's not just the race and ethnicity disparities, but there's economic disparities, there's lifestyle disparities, there's household composition disparities. Like there's all kinds of different ways that we need to be able to think about situations that are not like our own and be able to address those situations in a compassionate, caring way. And I think data helps us to see what those conditions are in a very objective, non-judgmental way, and then be able to address them and move forward with solutions that work.
Thank you, Mr. Rivera. I have one more question for you from YouTube. Can you speak about the way you think of other states can build to modernize workforces and build digital skills?
So we call that the data talent pipeline, and it's working with academic institutions at all levels of K-12, post-secondary and community college, and then college and even vocational schools, being able to identify what are some of the resources and students that can participate in a wide variety of different projects for your organizations. So that's one aspect of it. And what we have is the Commonwealth Data Internship Program, in addition to the Rural IT Apprenticeship Program, which I talked a little bit about earlier. The Commonwealth Data Internship Program pretty much is a matchmaking service for data analytics, right? So it looks at different academic institutions that have a data science program, and then links up students from those institutions with agencies that need help in implementing data projects and bringing those two together. So where the agencies have the problems and the data that they want to be able to solve those problems with, the students have the skills and the tools to be able to solve those problems. And bringing those two together is one of the key components of the Commonwealth Data Internship Program. In addition to that, we also have web-based training or in our learning management system. We've developed courses on data governance, helping to increase data acumen across the workforce. So that's 100% free across all the different employees within the Commonwealth. So we're able to leverage the knowledge we have, like as I was saying earlier, shared services, right? Things that we can do as a centralized service that we can then disseminate to all the different agencies so they don't have to reinvent the wheel, is a big way that we're doing that. And we're also partnering with Radford University to develop a data. It's not a data science program, but it leads to a data science program where it walks through all of the different components from data governance all the way through some basic data analytics. What does it take to get there, right? And it's completely web-based, self-paced, competency-based online program that allows any learner across the Commonwealth to be able to leverage those courses and get up to speed very quickly in data, having a better understanding of how to use data effectively within their organization.
Thank you so much, Mr. Rivera. And shout out to our listeners and viewers on YouTube. We have another question from our YouTube fans. What steps are being taken to ensure resources for community recovery infrastructure are getting directly to those communities. For example, rural broadband money not being plundered by corporations. Anybody who would like to answer that?
I would say this is an opportunity for aggressive advocacy on transparency about where's the money going with your state, because it's relatively easy to track where the money, when the federal money delivers money to a state, but where it goes after that, and that you should be able to find, I think, is on usaspending.gov. Should start to document some of those transfers. But once it gets to the states, then it becomes potentially more opaque. So I don't know, Mr. Rivero, do y'all have any plans in Virginia for transparency on the re-granting of those federal funds and some accountability on outcomes? And I remember when I was in local government after Katrina, it was really hard to demonstrate which neighborhoods the recovery funding went to. That's harder than it sounds, and you sort of have to plan ahead for it. So, like, what's Virginia doing, or what have you heard other states doing?
So that's a great question, Denise, and definitely from our viewers. Oversight is incredibly important, and being transparent is a huge part of that. And so we have our open data portal that we are using to publish as much open data as we possibly can and provide our residents with insight into how the government is spending its money, right? And what communities are being served by the different resources that are being expended. And one of the things that we talk about a lot is how do we link services to outcomes, right? So what are the services that we as a state government are providing that are generating the desired outcomes in the communities that we're serving? And so being able to do that in a easy to follow manner is really what the open data portal is all about, is being able to link up all of those different services across multiple agencies that are being provided to a community with the outcomes, and then publish that data in the open data portal so that anyone can look at those data sets and be able to start making their own determinations as to whether or not their community is being positively or negatively impacted by the services that we're providing.
With that, Jenny, the infrastructure question stayed on that. I wanted to highlight Dr. Bustamante's report. He's with the SEEP team. He actually, last week or 2 weeks ago, he released the Build a State's Labor Infrastructure Report. And he talked about, being able to allocate funds going directly to labor infrastructure and what it means and what it looks like to make sure that those funds are being used to help, in a situation like what we're going through now with having hundreds of thousands of people on unemployment, but them not receiving the funds in a timely manner. So we kind of drew it back to that being an infrastructure issue. So if you wanted to go to our website to check out that report, it is on there for you guys to view and to learn a little bit more about what infrastructure needs are when it comes to labor.
Thank you so much, Dee Dee. Yes, please make sure to visit our website, theseep.org, for that report and many other reports that we have on there. We have another question, and this will be our last one to wrap us up, but I think an important one for everybody. As we're considering all this research that we're doing, and as we're moving forward to make sure that we have prosperity after this pandemic, what are other data points that you're interested in researching or tracking in moving forward with our recovery? And anybody can answer that.
Oh my goodness, I'll jump in. There's just so many. As Denise was describing, we really need timely, high quality data about school attendance. It might be sort of surprising that that's not readily available, but it's not. And we're delighted that Department of Education is starting to pull that together and work with states to get that pulled together. What we really don't have is data on childcare. And we know that a lot of childcare centers have closed. And that's going to be, as we know from post-Katrina work, there's kind of chicken and egg problems in recovery, right? Where some things can't happen until other things happen. And so having childcare centers that work is going to be just as important as having schools work so that parents can go back to work. And so that's another one that's really important. We need more timely data on the effects of disasters. We get actually more data about the cost to property damage than we do about the people killed. And sadly, a lot of our recovery policies are oriented on compensating people for their property loss. But that means that a family of 5 in $1 million house gets more money than a family of 5 in a $150,000 house, even if it costs the same amount of money for each of them to rebuild those houses. They just happen to be in different neighborhoods. It also means we tend to provide more protection for richer neighborhoods and more protection for industry in our planning. So we need much better data about who's affected on a human level by disasters, and so that we can figure out how we're going to really help more folks after disasters, rather than just based on property. We probably have a huge wish list, don't we, Denise, of other items?
We do. I'll just add, because we've spoken so much about broadband, I feel like that those data that private companies are holding is really the next frontier for transparency and accountability, especially if federal dollars end up going to those companies to help build out broadband in communities. They should provide really good detail on where the money is going and what the level of service is. So I think that's something that we can all start to advocate for, is greater transparency from companies who are providing infrastructure resources like broadband.
Thank you all so very much for your insight, your time, and your support on this effort. To Mr. Rivera, we appreciate you coming down all the way from Virginia. Get it? Because we're on the internet. To Denise and to Dr. Plyer, thank you so much. Even in a whole storm, you and Didi are holding it down in Louisiana, and we so appreciate your insight. Thank you all so much. And now I want to kick it over to Dr. Janine Abrams-McLean.
All right. And so thank you all for joining us today. I know that you got a lot of information today, a lot of action items about what you can do. And I want Jason to pull up our call to action slide so that we can give you your marching orders, right? So when we end these, we like to make sure that people and communities know what is needed. So we have 2 calls to action. So as funding flows into Southern communities like yours, we must ensure that there is transparency in where the money is allocated and why it is allocated. And just as we said earlier, civic engagement will be more important than ever to ensure that federal dollars are used to the greatest impact, and that those federal dollars are used in the ways that your communities need them to be used. Our second call to action is that to ensure an equitable recovery, Southern states, which have been hit extremely hard by this pandemic, must invest in data infrastructure. You heard from Mr. Rivera today about how important that is. And that includes systems that track COVID-19 tests, variants, and vaccine updates, and vaccine uptake. But even more, we need systems, and we need to bolster systems that track the delivery of public assistance benefits and measure the effectiveness of education and skill building programs for both youth and adults. We need to make sure that we don't have missing data. And to do that, we need to make sure that there is a robust data infrastructure. And so those are our calls to action. Talk to your leaders, your local leaders, your state leaders, your federal leaders. Talk to anybody that you need to make sure that in the South that we can have transparency and data infrastructure. And now I'm going to kick it back over to Jenny, who will close us out.
Thank you so much. We appreciate your time, your attention, and your support of these major issues that we speak about. Thank you to Fair Count. Please visit them at faircount.org. To our friends at the National Conference on Citizenship, they can be found on ncoc.org, and SEEP, the Southern Economic Advancement Project. That's us, the SEEP.org. And then all together now, you can visit www.pandemictoprosperity.org for more information and our reports and updates available on the website. We will also be following up for those who have joined our registration list with more information about this and other events that we will be hosting. Thank you all so much for your willingness to speak with us and for the information that we heard today. We thank you, we appreciate you, and we wish you a wonderful rest of your day. Stay safe and stay home. Thank you so much.